This brief slideshow introduces the new scientific understanding of pain and how the neurophysiologic pain profile helps healthcare providers, case managers, adjusters, and patients understand how best to prevent chronic pain and reduce its disabling impacts on those suffering from chronic pain. The sad fact is that current medical pain care is failing the American patient and American society. This slide depicts national trends since 1996 through 2005 demonstrate that more Americans are becoming disabled due to medical overdiagnosis and overtreatment. Since 2005, the problem has become worse with more disability and death. You can see that there's an increased incidence of lumbar spine imaging, opiate analgesic prescriptions for spine problems, lumbosacral injection, and lumbar fusion rates, all of which increased. But the resultant is an increase in musculoskeletal conditions. The pain experience and brain-body reactions are caused by a combination of 1. Tissue pain generators, 2. Peripheral nerve activation, 3. Spinal cord and brain analyzers, and 4. Brain tissue responses that change endorphin and dopamine levels and affect tissue, healing, and personal behavior. This is not science fiction. Science is now beginning to show the brain and spinal cord pathways that accept and send out signals from and to the body. The left column shows the descending pathways that can decrease in red or increase in green pain, fiber, noise. This slide shows some of the brain areas involved in the analysis of the pain experience and emphasizes their complicated interactions, which include the amygdala, hypothalamus, and reticular formation. This science alters the clinical definition of pain, which clinically combines 1. Tissue tenderness, emotional components, and psychological factors. It is necessary for us to first understand the definition of pain before we can address intervention and evaluation. Einstein said, if I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about solutions. He was emphasizing the importance of knowing and understanding rather than overguessing. The best way to avoid medical overdiagnosis is thereby to accurately evaluate the components underlying each individual's pain experience. The neurophysiologic pain profile is an award-winning technology. It measures tissue pain generators in muscles and joints, biological reactions associated with fear, anxiety, and depression, as well as sociodynamic factors that increase the pain experience. In most cases, it accurately assesses the components of each individual's pain experience based on easily understood fight or flight reactions in a scientifically valid method. The NP3 is non-invasive and easy to perform for most individuals. The recording electrodes are placed to record the patient's body reactions, fight or flight, and muscle tension to stimulation that produces mild discomfort in painful body parts. There are 3 basic profiles for NP3 that can point to a patient's needs. In this case, we see a sensory physical profile. We see responses associated with stimulation. This is a sensory physical profile. where the patient needs relief from painful tissue, in this case, low back muscles. This type of response shows that the patient's low back pain is being driven primarily by anticipatory and reactive flight responses. Here, we can see prominent stimulation-independent changes in a skin conductance response and surface EMG. This has been called pain fear avoidance and usually responds to non-physical methods. This profile shows an absence of brain-based fight or flight responses. Here we see an absence of any physiological response associated with stimulation. This sociodynamic response is usually generated by deep-rooted psychological problems like previous childhood abuse, physical assault, or sexual assault. The NP3 is an award-winning technology that accurately defines the needs of most patients with chronic musculoskeletal pain. Like Einstein knew, understanding and knowing is far better method of finding answers than guessing or misleading.